Hello, this is Dr. Do again. This video is still on alphabetic list of problems. I think I finished the diseases or concepts or conditions associated with the letter, start with the letter P. Today I'm going to move on. In terms of letter Q, actually not a common diseases coming to my mind. I start with the letter Q. Some of the diseases named by the physician's name start with Q probably, but still it's not common, and also usually those are the rare diseases, or some of them are common but probably already included in my previous videos, like some diseases about the joint or the degenerative change of joint arthritis. I think I mentioned before, probably just alter the names. But today I'm going to move on to the letter R. First thing came to my mind is respiratory diseases. Of course, it's so common, and it's so kind of distribution variety in terms of the severity. It could be very minor, like a rhinitis or just the viral caused upper respiratory tract infection. Couple of days, you're just back to normal. Or could be very serious, like pulmonary embolism or respiratory failure. So this is such a important variety of comprehensive conditions. So I'll probably start from one of the most common one, upper respiratory tract infection. I think I mentioned it before when I talk about the lung disease or pulmonary diseases. But I think I did not, when I talk about the pulmonary disease, usually talk about those really the infections or any disease deeply in the lung, beyond the secondary level of trachea or bronchi, and the tertiary level will be inside of the lung. So probably that's where I focused on. But today I'm going probably this video is just on the upper respiratory tract infection. It's so common, you probably know it. It could be the rhinitis or sinusitis, or the even I think sometimes the pharyngitis, laryngitis, or just common cold or flu. So these are all the variety of category of this upper respiratory tract infection. It could be the viral, bacterial allergy, and also of course asthma is also belong to. Sometimes it's depends on the age, depends on the cause of asthma. Usually it's also it's not included in this upper respiratory tract infection because the cause of asthma, even though sometimes associated with infection, but it's not the infectious disease. So when I talk of this upper respiratory tract infection, usually refer to the conditions caused either by viral or bacteria. And so the most common, actually, the risk factors. Let's talk about the risk factors, because you know the symptoms. May or may not have fever, or may not have sore throat, may or may not have coughing, but in general, nasal congestion is one of the most common presentation, and coughing probably is next, and also some headaches and fever, and may or may not have nausea, vomiting, depends on the age. In young children may have all of these, but in a young adult or middle-aged adult, probably sometimes serious, sometimes not. Depends on the risk factors, depends on the causative etiology, and also depends on the comorbidity, whether there is some other diseases. For older people, really, I think it's more than that. Probably for older people, particularly for this older with systemic diseases, pre-existing COPD, pre-existing asthma, pre-existing any systemic disease might go deeper to the pneumonia. But I'm just talking about not in that group, older people or not young children. The older children, young adult, middle-aged adult. What are the risk factors for the upper respiratory tract infection? First of all, I think the lifestyle, overweight can increase the risk of this respiratory tract disease because of the reflux, the limited respiratory function. If you recall, if you know it, the breathing is really both the function of lung and also the abdomen, particularly for male, because they're the adipose tissue, overweight, the adipose tissue distribution around the waist. So that's impaired function, increased risk. And also the smoking, either current, continuously or remote, or the exposure to the chemicals, the air, and also the coldness itself. Some people say there's no study to show this properly, but if you just the common sense, if the coldness will cause the constriction of the either the respiratory tract or any smooth muscle associated organs in the blood vessel, of course sometimes constricted in the cold environment. So it depends. So these are the risk factors. Of course, on top of that is the comorbidities and other diseases, particularly for those who have chronic lung disease, either asthma or COPD or bronchitis. Of course, this is the risk. In terms of the preventive, you probably know it. It's so common. Wash hands, or currently talking about other strategies like PPE, and also keep distance, particularly during this season. And there's something I think just the fundamental scientific. There's no medical proof, but I just think it works because first of all, the virus, we know the virus are the DNA without any other structures. The DNA is the main component for the virus. And to denature the DNA, to deactivate the DNA is by either acid or base. So if you use a little white vinegar in the water, to use a Q-tip to swab your nose before you go out or after you're coming back, or a little lime juice or lime, a drop of lime, might also serve the same idea. Or you can use the, I recommend acidic rather than basic alkalic, because if you recall, the mucus, moisture mucus really decrease the risk, but if it's dry, increase the risk of viral infection. So if you recall all the basic alkalinic, like the sodium bicarb or even calcium carbonate, they are all the solid form. They use for the desiccator, which means to dry the air. So if you use that, probably can cause the mucus dryness. There's no study, there's no report, but this is just the fundamental scientific knowledge apply here, and you can use it, you can try it, or you can just find a theory against this. But this is how I found effective, and there's some probably some not a common not a lot of literatures. So this is about how to prevent this infections. Of course, filter the air, keep it warm. How to filter it? You find your way to keep how to make the breathing air keep warm. So there are a lot of variety possibilities. So this is about. I think this video is about upper respiratory tract infection, viral actually. I'm not talking about the bacteria caused then, because viral infection are the quite common one. So I'm going to stop here, and I hope this video will not mislead you, and hope it will help. Thank you for watching. I will see you next time.